Actually, we're live now on Facebook. Good evening, everyone. Good evening, IFNG and Elite Squad.
Hello, good evening, everyone.
Hello.
Okay, let me.
Good evening. Good evening, Sir Clint, Sir Jeff.
Hello, Mr. M. How are you?
Yeah. Hi, Marvin.
Hi.
Yes, I'm gonna make
Going
you
to work.
co-host.
Oh, you're going to
Hi,
work.
sir. Hi, guys. Hi, Sir
Hi,
Joseph.
Zaya.
Hi, everyone. Hi,
Hi,
Sir
Miss
Hi,
Zaya.
Isaiah.
Joseph.
Sorry,
Good evening.
I'm late. So yeah, I think our topic today. I'll just reconnect my. Oh, Sir Clint. Hi,
Hi.
everyone in our Facebook.
Hello, everyone on our
Sir
Facebook
Clint,
page. Hello. Yes,
are
Sir
you
Jeff, I'm
there?
here. Yes, yes. Can everybody hear me? Hello.
Yes. So yeah,
Okay. Hello, guys. Good evening,
yeah. Can I see
everyone.
you? Yeah. Hi, good evening. Welcome back. Yeah, sorry, a
Welcome
little bit
back.
late.
Yes.
Yeah, before we start, where are you right now?
I'm in New York City. Yes. New York City, Cubao.
So for our topic, it's OET versus IELTS.
Yes, I'm actually very excited about this one because a lot of nurses actually who are planning to go to the United States of America do not know that they can now use the occupational English test. Okay, so later on I will detail on that. Hold on, guys. Let me just share
Sounds
the live.
interesting. So
Yes,
yeah, I
no,
would like to say hi first to my co-admin Marvin. Hi, thanks for coming, and to your elite squad, Zaya, and to our Facebook
Hi,
viewers.
sir.
So
hello
yeah, Sir Clint,
everyone.
without further ado, let's begin.
Okay, guys, so let me share to you my screen as regards our discussion for tonight. Now, before we even begin our discussion, guys, this is pretty much useful in heaps of ways because a lot of nurses do not know that you guys can now use the occupational English test, not just for the United Kingdom, but also for the United States of America. So later on tonight, I will be detailing on the things that you would need to know for the occupational English test, as well as, of course, where can you use this examination. Sir Joseph, is it true the OET is the easier version of the IELTS? Okay, that's the first question that we're going to be demystifying tonight. Okay, in some ways, guys, the occupational English test is easier. Okay, it's easier in some ways, but not in all aspects. Okay, there are technicalities here that you would need to master for the occupational English test. Of course, given that it is profession based. Okay, when we say it's profession based, guys, what we mean by this one is the occupational English test will highly be dependent on your profession. Okay, so if you are a medical professional, then of course you can take the occupational English test. Okay, so of course, OET for doctors, nurses, pharmacists, there you go. A lot, or there is a range of things that you can actually that can qualify the students when it comes to the occupational English test. So based on the experience of my students, okay, let me just share this one, okay? If they cannot pass the IELTS like, let's say 10 times, 10 times already, okay, or 8 times already, right before they give up, they take an OET test, okay? And they sometimes get their target scores with the occupational English test, given that they say, and I said that, charing. Wait lang, sabi ni Mr. M, Mother D cares fresh. Oh yes, guys, please make this trend. Tag your friends with the hashtag Mama D cares. Okay, so guys, yeah, tonight we're going to be having a fun, it's like getting to know the occupational English test. And of course, what are the things that you can actually benefit from when you are taking the occupational English test as compared to the IELTS examination. So without further ado, let me just introduce myself. If it's your first time to be here, blessed to be here. My name is Clint Joseph Tyler, the founder and master lecturer of Elite Intellect, IELTS, OET, NCLEX, and NMC CBT specialist, PH. Okay, ang dami ha. Ang haba. Okay, so I am an IELTS expert for the past 11 years, an OET master for 6 years. I have taken the occupational English test twice. Okay, one for occupational English test version 1, and then another one on the occupational English test version 2. Okay, now good. Happy to say that I was able to get an across A on all the subtests of the occupational English test. Now, I am a registered nurse. Also, if you guys do not know, your mama is a PH registered nurse and also a USRN, and also known as your mother dragon, mama D, mother D, mommy D. Okay, half Filipino, half cookie. Alam nyo guys, let me just share. One of the challenges that I face every week during the discussion is not the discussion itself. It's thinking of my half, no? I started with half Filipino, half amazing, half Filipino, half siopaw. There you go. Half Filipino, half mambabarang, mga ganyan, half Filipino, half Filipina. And now I am half Filipino, half cookie. Siguro next week, half Filipino, half askal, di ba? Oh my gosh, energy level brought to you by, yes, cookies and cream. My dream, my dream. Energy brought to you by Sinovac. Yeah, if you guys don't know, I just got my vaccination. So I'm a little bit not oofy at the moment, no? Pero syempre, energy of mama is still here for you guys for tonight. Okay, so officially I am made in China. Chareng! Okay, so let us talk about the occupational English test, okay? Now, by definition, guys, what is OET, okay? And to answer the question, can I replace my IELTS with my OET? Yes, you may. Okay, because this is another English exam prerequisite that is now widely accepted worldwide, okay? So if you think that the OET is just limited to the, what do you call this? If you think that the OET is just limited to the United Kingdom or Ireland, well, you're thinking wrong, okay? Because the occupational English test is now also accepted in the United States of America. And later on, I'm going to be talking to you about the specifications before the end of the program on how you can apply your occupational English test for your visa screen on the United States of America. Oh, diba? An easier option for you. Sir, is the OET much more expensive? Carry lang, no? The OET is a little bit expensive as compared to the IELTS examination. However, guys, what I would want you to remember with the OET is a lot of students, based on my experience, most of the time, 90% of students get their target scores with the OET within one take. Okay? So kung applicable naman, kung saan ka pupunta, why would you take 10 times if you can just take one? Right? Okay, so the occupational English test, also known as the OET, is one of the accepted English prerequisites designed for medical professionals. The OET is focused not just with your English skills, but as well as your professional knowledge. That's the advantage of the occupational English test, is that it's focusing on your professional knowledge. As I always tell my OET students, it's easy to be a nurse if you're already a nurse. Right? So of course here, you would need to assume your own profession, given that there are a lot of differences between the IELTS and the occupational English test. And later on, I will elicit about the differences, what are the easy sides, what are the difficult sides of the OET, okay? None is ever easy, believe me, okay? Now, before anything else, guys, okay, let's take a look at the verse for today. Behold, I am with you, and I will keep you wherever you go, and will bring you back to this land, for I will not leave you until I have done what I have spoken to you. This is from Genesis 28, verse 15, a promise of the Lord to the people, right? So wherever you go, wherever you are, wherever you plan to go, remember that the Lord is always with you. Okay, that's basically it. This is his promise. He will not leave you until he has done what he has spoken to you. The Lord has thousands of promises in the Bible, if I remember it correctly, 8,000 promises. And of course, guys, if you are feeling down at the moment, if you are feeling uncertain, if you're feeling afraid at the moment of the things that might be happening in your life, you have to remember, even if you feel alone, the Lord is with you. Okay, that's one thing, one of those important lessons that we're going to be talking about tonight. All right, so what are the medical professions that can take the OET? Okay, so the OET, guys, is designed for medical professionals. Okay, so what are these medical professionals that are allowed to take the occupational English test? Okay, so you have dentistry, there you go, dietetics, okay, medicine, okay, nursing, of course, occupational therapy, optometry, pharmacy, physiotherapy, podiatry, radiography, speech pathology, and veterinary sciences. Okay, sir, hello. The OET speaking is role play. What about for veterinary sciences? Will we be talking to animals? Are we going to bark with them on the role play? No, okay? Because I have students too who are on the veterinary science side, okay? You're not going to be barking at the dog or the animal. Basically, you're going to be, what do you call this, role-playing with the owner of the animal, no? Baka ang iniisip ng mga veterinary sciences natin, tatahulan nila yung aso sa role-play. No. Okay, now, sir, I'm a nurse, okay? I'm a nurse. What should I be doing with my occupational English test? Basically, if you are a nurse, okay, then of course you might be role-playing with the patient, okay, or you might be role-playing with the relative, no? Challenges that we face with the OET role-play before is you are talking to a patient's relative who is quite worried, extremely worried, anxious about that. And need I remind you, when I took my occupational English test, that was 2 years ago, okay, the second one that I took, my role-play is a dying patient. Yeah. She was diagnosed with end-stage cancer. So how can you become an effective nurse on that situation? So that's one thing that you would need to remember for this one, guys, is you always have to think, okay, how can I become a vital component of the care of the client when it comes to the occupational English test? Now, more about that later. We're going to be talking about this one. I think for the 4 discussion weeks, we're going to be talking about the OET, okay? So if you are interested in the occupational English test, ngayon pa nalalaman nyo na pwede na siyang gamitin sa USA, why not? Attend your OET lectures here by Elite Intellect every Friday at IFNG, okay? Because next week, I think I will be eliciting about speaking and writing. Okay, so where is OET accepted? Okay, guys, the OET is generally accepted as an English skill prerequisite in the following countries. If you are a nurse who would want to go to the United Kingdom, it's accepted. Australia, it's accepted. Ireland, it's accepted. New Zealand, it's accepted. And United States of America. Just recently, guys, the good news about this one is it is accepted in the United States of America, but not in all states. Later on, before the end of the program, I'm going to be showing you which states do they accept the occupational English test, and of course, what are the target scores that you would need to get. No, malay mo yung ina-applyan mo, andun pala yan, no? Sa mga states na sasabihin ko. And of course, guys, one state in particular there will surprise you how low the occupational English test prerequisite is. Napakababa, guys. Ito talaga yung pag nag-review ka at nag-take ka ng OET at di ka pa nakapasa, ewan ko na lang sa'yo talaga. Di ba? Okay. So guys, yes, question, okay? Question. Which state do you think has the lowest prerequisite, okay, in the United States of America? Come on, guys. I want to see your guesses. Which state, okay, do you think has the lowest prerequisite when it comes to the occupational English test? Guys, pardon my voice. It's a little bit froggy right now. This is brought about by the vaccine. I've been like this for the past few days. Okay, haha, ang hard, Florida. Sabi ni Sir Jeff, Florida, correct! Diba? You'll be surprised on what is the accepted score for Florida. Okay, so later on we'll talk about that. Okay, now, guys, let us look at the grading scale of the occupational English test. Okay, here, guys, unlike the IELTS, you're graded on the IELTS from 1.0 to 9.0. 1 being the lowest and 9.0 being the highest. Whereas in the occupational English test, guys, you're graded from E to A. Okay, that's E being the lowest and A being the highest. Okay, so what are the equivalents when it comes to the IELTS? Okay, sir, bakit ganon? 450, 500 points? 42 points lang po yun kasi they multiply that and they divide that. Okay, that's the computation. Okay, so for grade A, guys, it means that you got 450 points to 500 points, which is equivalent to an 8.5 to a 9.0 on the IELTS test. For B, that is 350 to 440 points, 7.0 to 8.0 on the IELTS examination. C plus is 300 to 340 points. That's 6.0 to 6.5 on the IELTS exam. And of course, C is 200 to 290 points. That is equivalent to 5.0 to 5.5 on the IELTS. Wala namang gusto makakuha ng C, ano? Okay, what else? D is 100 to 190 points, 4.0 to 4.5, and 0 to 90. E, that is 1.0 to 3.5 on the IELTS. Wala namang, guys, nakakakuha ng E. No? Kahit sa IELTS, wala naman nakakakuha ng 0. Not unless kung nategi ka the day before your exam, di ka naka-attend. Di ba? Charing! Joke lang po. Di ba? O kaya, hindi ka umattend, di ka dumating sa exam venue, ganyan, makakaika talaga. No? Ang hard talaga. Di ba? So guys, yeah. Look at that. Sir, question. In your 6 years of teaching the OET and 11 years of teaching the IELTS, have you seen students who converted to the OET program and got their target scores? Myriads. Totoo. I've seen a lot of students who gave up on their IELTS preparation because it's too technical for them, and then they moved on to the occupational English test, and it became their comfort. No, it's comfortable for the nurses, especially because you are going to be assuming your professional role. You have been a nurse for how many years? And on the occupational English test, if you are a nurse, and you know a lot of details about nursing, it would be easy for you. Yeah, believe me. Okay? Because guys, on the IELTS, it's just pure English skill assessment. Okay? It's pure English skill assessment. Whereas on the occupational English test, it's not just your English skill that they are assessing, they're also assessing your nursing knowledge. Okay? So if you're a nurse and you're really good with nursing and you really love nursing so much and you believe that nursing is an art, then of course it's easy for you to get that grade of B. Okay? All right. Yung mga sumuko sa IELTS pumasa sa OET, totoo. That's true. Real talk. Legit. That's legit, Sir Jeff. No, I have seen a lot of students before they just gave up on the IELTS. They were like, I have taken the IELTS 5 times before. Sir Joseph, may I enroll at the OET program and convert and review? Okay, and then they're going to prepare for, let's say, a month because there's not much to learn. With the OET, basically, you're converting your knowledge of the IELTS. With the OET, what we do as lecturers for the OETs, we just incorporate nursing knowledge and of course different types of techniques for simplification, highlighting with the writing, and of course the role-playing techniques. And then after nyan, lalabas ang score nila ng OET, pack in a snap. They got a grade of B, which is quite difficult to get on the IELTS exam. Sir, question again. Is the OET now? Hello, Mommy D. Regards, please. Hello, Tony, my love. Okay, so yeah. Mama D, is the OET now up? Computer-delivered OET, is it now available? Yes. As per OET, computer-delivered OET is now available on the nearest testing center. Okay, so meron na din pong computer-delivered OET. Like the IELTS, they promise that their scoring will no longer last 3 to 4 weeks. No, it's just 5 days, 7 days maximum, I think. Okay? Kasi yan ang last communication namin ng mga OET specialists sa Pilipinas. Okay? Now, what is the exact expected grades on the OET? Like the IELTS, guys, of course, if you are aiming for a safe score on the occupational English test, of course, you would need to aim for listening B, okay, which is equivalent to 7.0. Okay, reading B, 7.0 to 7.5. Speaking is B, 7.0 to 7.5. Writing is also B. But in the United Kingdom, guys, they accept a C+, okay, with writing. Okay, so B, C+ para sa United Kingdom. Sir, may nabalitaan ako. Madali daw po ang writing ng OET. Kasi po, letter writing. Is it true, Sir Joseph, that the occupational English test's writing is letter writing? Yes. No? You're going to be writing the letters. No, letter A, letter B, letter C, letter D. Charing, direct, wala yun. Paki-out. Okay. So yes, it's a letter. Letter of endorsement, letter of transfer, there you go, letter of referral, yung mga yan, no? These are the letters that you're going to be writing on the occupational English test. Okay, now, can I combine scores on the OET? Yes, you may. Combined scores on the OET is actually accepted, and one of the examinations that they accept combined scores that they highlight in most countries is the occupational English test, no? Halimbawa, on your first take, no? Let's say on your first take, you were able to get a B in listening, C+ in reading, okay? And then you got a B in writing and then B in speaking. So sablay ba, Sir Joseph? Let's say my target score is the United Kingdom, where I'm expected to get a B in reading. Yes, sablay yung reading mo. So on the next time that you're going to be taking the occupational English test, guys, you would only need to focus on reading and get a B on that. On the other subtests, pwede ka nang makakuha ng C+ lang. Okay, just ensure that you're going to be taking the next examination within 6 months of your first stage. Okay, so that is what we call the combining scores in the occupational English test, no? So sir, do you mean when I go to the next OET exam and I retake my exam to combine my scores, I don't need to get a B on the other subtests anymore? I only would need to get a B on the subtest that I failed. Yes. Okay, but with the condition that all of the subtests that you passed before on your first exam, you would be getting a C+ on that. No? Ang saya. Diba? So you can combine your scores as long as it is taken 6 months. Okay? 6 months after your first examination. And it's fun. Okay? It's fun. Because based on my comparison on the IELTS exam, correct me if I'm wrong, okay? But some states do not accept combined scores, right? Like if you failed this time, you would need to retake it, okay? And then what if you failed in another subtest or retake again, and then you failed in another subtest, you retake again. Whereas on the occupational English test, you can combine your scores, okay? You can combine the first exam and the second exam, or if you fail the second exam, you combine the first exam and the third test. Wag naman, in Jesus' name. Diba? So again, that's the advantage of taking the occupational English test is students can combine their scores and they're not stressed out anymore. Because once they retake that and they're aiming for a combined score, guys, they don't have to focus on the other subtests as much anymore. Okay? They would only need to get the grade of B on the subtest with which they failed. Di ba? Ayaw mo parang OET? Diba? Masaya kaya kami sa OET. Okay, wala kaming stress. All right. The same applies also for IELTS, sir, regarding combining scores, also the duration. Pareho sila, no? Pero alam ko some states, they do not accept that, no? Sa UK, hindi rin yata tinatanggap yan. Okay, now, is the OET easier than the IELTS? Here's the important question for the night. The million-dollar question is the OET easier than the IELTS exam? In some ways, the OET is easier as compared to the IELTS because of the following reasons, okay? Let's take a look at the reasons why the occupational English test is easier as compared to the IELTS test, okay? Number one, it is close to your knowledge with your profession. So in other words, it is easy to be a nurse if you are already a nurse, right? It's already close to your knowledge as a nurse. It's close to your experience as a nurse. It's close to what you know as a nurse. So why stay away from being a nurse, right? Why go away from being a nurse if this English test could, if being a nurse could actually help you on this English test? Okay, what else? The speaking of the OET Part A is not yet graded. Yes. On the occupational English test speaking, guys, you are going to be having 2 parts, Part A and Part B, okay? And on the Part A, that's not yet graded. The purpose of the Part A is to set you comfortable on an interview situation. Okay, so a lot of students, they actually do feel a lot of relief with this one when I say, hey, calm down, your Part A is not yet graded. Okay, but of course, I'm not saying for you to not do well on your Part A. Okay, because guys, you're already being gauged. Okay, you're already being gauged here. Sir, is the person that I'm talking to that day, will they be the will that person be the one to score me? No. The person that you'll be talking to that day, just to remove the pressure, is an interlocutor. Okay, the interlocutor's job is to deliver the role play. That's basically it. The interlocutor's job is to instruct you. The interlocutor's job is to ask you questions. The interlocutor's job is to conduct the role play with you. That's basically it. There are 2 assessors who will be listening to your recordings, and they will be the ones who will be grading you. So a lot of students, they say, every time that they hear this, it becomes comfortable to them in a way that they're not pressured that the person they're talking to on that day will be the one who will be giving their grades. No? So yan. Sir, what if I have a problematic score? Let's say the examiner 1, assessor 1, and assessor 2 did not agree with the scores. Then you will be referred to other senior assessors. No? Yung senior assessor, sila naman ang magbibigay ng score sa'yo. Kaya may fairness talaga. No? If you have problematic scores, there are 5 levels, up to 5 levels of assessments, right? 2 assessors, 3 senior assessors. Diba? So, imposibleng mag-gradean ka pa ng tama dyan sa occupational English test. Okay? What else? The speaking of the OET are role plays, right? Don't we all love role playing? Rar. Diba? Ooh, I'm a nurse. I'm a nurse. Yung ganyan. Okay. So, the task on the writing is to write a letter. Okay, basically, you would need to write a letter on the writing of the occupational English test, and you just have to base your letter on a case note. Sir Joseph, what's a case note? A case note contains the information about your clients, and not all information on that case note should be included on your letter. Let's say there are 152 details about your clients there. So expected for you to include on your letter would be just around 50 details about the clients. Basically, the only thing that you would need to work on the occupational English test is your analyzation skills, if this one is connected to the case or not. I'll give you an example. The present case of the client is cardiac anomaly. Okay? The present case of the client is cardiac anomaly. Okay? And then in the past, they have had a condition which is bone surgery and wisdom tooth extraction. Which one among those two is connected to cardiac anomaly? Come on, tell me. Is it the bone surgery or is it the wisdom tooth extraction? Nakalagay abscess tooth. No? Which one? Come on, nurses. Let's analyze. Let's analyze, nurses. No? Sir, parang ang dami mong alam yata sa nursing. Hindi nyo natatanong, ako din nag-lecture sa NCLEX at sa NMC-CBT. Okay. So, the tooth extraction is related to that because there's a tooth abscess. Kung pwedeng nalunok ng client natin yung bacteria, diba? And then it went down there to the pipe and then it went to the blood and then it circulated to the heart. Oh. So yeah, if you're going to be looking at that, analyzation skills matter. Okay, let's say the condition of your client is diabetes. Okay, diabetes ang condition ng client mo. So alin dito ang related, no? Diabetes, being a teacher for 12 years, okay, or being a lawyer for 15 years. Which one? Diabetes, ang condition ng client mo. Being a teacher for 12 years or being a lawyer for 10 years? Teacher, lawyer, which one? Being a teacher? Teacher, or lawyer? Lawyer. Being a lawyer. Because they are put to unnecessary stress with cases. No? So, po pwedeng itong pasyente natin ay nag-i-stress eating. No? Teacher, viable, po pwede. Pero usually teachers give information about healthy eating. No? So, yan. No? Ang saya ng occupational English test kasi dito, gumagana yung pagiging nurses natin. Our interactive minds as nurses, they do look at the information there which are not related and then you're going to eliminate that. No? Even the normal values, we eliminated on the occupational English test. Okay. Tell me which one should be endorsed. Temperature is 39.8 degrees Celsius. Respiration is 80. Okay, 80. Respiration is 20. Okay, heart rate is 80. There you go. Blood pressure is 110/70. Which one? Yes, tinatanggap ng OET sa US. Yung febrile, no? So yan, kaya there are a lot of nurses who find comfort with the occupational English test because it's close to home. right? Hello, we spent 4 years studying nursing here in the Philippines, right? Including the review for our local boards and then becoming a USRN. So why is it difficult for us to take the occupational English test? It's just the language prerequisite. No? Pero yung nursing skills at knowledge, I don't doubt that us Filipino nurses are really good with that because we are quality nurses. They can send us worldwide wherever we go, right? We will be okay. So later on, I'll tell you which country and which state and the score, okay? Now, some say on the OET, it is also easier to amass their target scores. Yes, I have seen a lot of students who say, sir, it's very easy for me to get my target scores here. My gosh, after 5 takes of the IELTS, 1 take of the OET, finally, sir. Yan. No? Lalo na nung buhay pa, nung very popular pa guys ang OET, ang UKVI. No? UKVI before, as compared to OET, a lot of students prefer occupational English test. Okay, now, let's take a look at the OET listening, okay? So what are the things that you would need to know for the OET listening? So like the IELTS examination, there will be a recording, okay? And you would need to answer 42 questions. What? Sir Joseph, 42? On the IELTS, I'm only going to be answering 40 questions. Kalma, mas madali to. Okay, so for part A, this is what we call the consultation extract. When we say consultation extracts, there will be 2 recordings here about 2 people, a patient and a medical professional, any of the 12 medical professionals having a consultation about their condition. You would need to answer 20 items for part A, and here's the good thing. Wrong spelling correct. Yes. For the OET listening, wrong spelling correct. Okay, halimbawa, sinabi ng patient, well, I have been taking Robitussin so far. Robitussin. Eh, nakalimutan mo ang spelling ng Robitussin. Diba? You forgot the spelling of Robitussin. Diba? Ang nilagay mo, Robitussin. Single S with a W. It's still correct. No, it's still correct on the listening exam as long as it's readable, as long as it sounds like, okay, that could be considered on the occupational English test listening. Okay? Halimbawa, sinabi naman ng speaker, well, for the past 2 years, I think I've been taking erythromycin. Hi, 2 years. For the past 7 days, I have taken erythromycin. Eh, nakalimutan mo kung may H yung erythro, ng erythromycin. Diba? So, inilagay mo lang erythromycin. In-spell mo pa ng Tagalog, readable. Diba? It sounds like. So, that's accepted. That's the correct answer right there. That's why a lot of students love the OET listening, no? Because even if you misspell an answer, it's still considered as correct. Ayan, di ba, Sir Joseph, Sir Jeff, erythromycin, yung mga ganyan, di ba? Meron ngang recording doon. Ano yung sinabi niya? Amoxicillin. 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 Yung isang estudyante ko, inispell amoxicillin. Oh. So, correct. Di ba? It sounds like. Diba? Pangmayaman talaga ang OET, diba? Kahit mali-mali spelling mo, tama yan. Okay, just for your listening part A, okay? Not with the reading. Okay, now, part B, guys, is what we call the work-related extracts. Okay, here, there are only 6 items on the part B. And each item, guys, there will be an independent recording for that. The good news about the listening of the occupational English test is your part B and C are both multiple choice questions. Ayun na yung sagot. Pipiliin mo na lang. Diba? Piliin mo lahat letter A. Tingnan natin kung di ka pumasa. Yeah. That's the advantage of the occupational English test, guys, is that the part B and C, they're both multiple choice questions. The only difference is for part B, these are work-related extracts with 6 recordings. So what are examples of work-related extracts, Sir Joseph? It could be a briefing about the field of nursing. It could be a conversation between medical staff, an announcement about a new protocol. There you go. Or 2 nurses conversing about a procedure, a nurse consulting a doctor, No, that's part B. Whereas for part C, guys, this is a long recording with 2 recordings, 16 items which you need to answer. And of course, the recording is either a medical talk or an interview. Alam nyo, ang laging sinasabi sa akin ng nurses, Sir Joseph, alam mo kung minsan, because I know the case, it's easy for me to guess. It's easy for me to guess the answer because sometimes there are information there that you would need to answer. Which one is resistant to? Eh, alam mo. O, huwag ka nang mag-aksaya ng panahon. Isagot mo na yung alam mo. Ganun kasaya. And for the number of choices, guys, on the part B, there are only 3 choices, whereas for the part C, there are 4 choices right there. And of course, after the recordings, you have 5 minutes to check your work. Sir, do I need to transfer my answers? Do I need to transfer my answers? No, you don't. Just write it down there where it's supposed to be. No? Depende. There are 2 types of test papers. The one where there's a blank and then you would need to write it down there and then you would need to shade the circles, or there's an answer sheet. No? So yon. Lipat na sa UK, di ba? Oh, actually, kaya mga UK ko wala silang stress na pinagdadaanan eh. Di ba? Pero guys, it's still accepted. It's also accepted in the US later on. Pag-uusapan natin yan. Okay. Now, what about the reading? Sir Joseph, is it true that the reading of the OET is difficult? Yes and no. Okay, yes and no. My answer with that one is yes and no. Yes, it's difficult if you do not know where you're looking at. Okay, if you're wasting your time trying to read everything, it's difficult. However, if you're really good with analyzing which ones are the important information and where to look at, it would be easy. I have seen a lot of students who tell me, Sir, mas madali po ang reading ng OET kumpara sa IELTS. Meron din naman mga nagsasabi na, Sir, mas mahirap po ang reading ng OET kumpara sa IELTS. And then I asked them, are you looking at the correct places? And then they said no. So yeah, it's technique per technique. Okay, technique versus technique. So, Part A of the OET reading is what we call the expeditious reading task. From the word expeditious, you would need to find information, find words on that, because usually these are gap fill, matching text and sentences. There you go. Okay. Ay, may nagtatanong, Sir, may OET plus NCLEX kayo? Meron. Meron din kami OET plus NMC CBT. Kala nyo Okay. So, guys, the part A of the occupational English test is strictly timed 15 minutes. Okay? You would need to answer 20 items, so less than a minute per item. That's the challenge, no? You would need to answer it all in, di ba? Walang kawala, di ba? Okay, the mother of promos, di ba? Abangan nyo, di ba? Mother di lang ang all around. Kung minsan nga, ito yung estudyante ko, Sir, nasang discussion ka? NCLEX. Nasaan ka ngayon? NMCCBT. Nasaan ka? IELTS. Nasaan ka? OET. Diba? Kuratsa. Babaeng walang kurap. Okay. So yeah, it's strictly time 15 minutes for the part A. Guys, I have seen a lot of students before. No, not a lot, but one student. One student on the OET, okay? This is based on my personal experience. The interlocutor said, time's up for part A. Submit your papers. Kasi yung part A, ipinapass natin yan. We submit them to the interlocutors. And then my student decided to continue writing the answers. And then the interlocutor said, warning. And then she kept on writing the answers. And then the interlocutor said, invalid. Wanna make a guess? Okay, on what's her score in writing? She got an E, okay? Because her writing became invalid, okay? All right. Hold on. Hi, sir. How can I enroll for the OET review? Hi, girly Guillermo. Sir Delo, please send, what do you call this? The link to the Facebook page. Okay, guys? Girly, Sir Delo will be sending the link of OET Intellect on our chat box right there. Okay. So, what else, guys? Ooh, what happened? I think I may have pressed the wrong button again. Have you guys encountered this with Zoom, the button problem? Okay. Multitasking, di ba? Ako din guys, naglilinis ng CR ng office namin. Hindi ako nagbibiro. I'm not joking. Yeah. Some people think that I am, what do you call this, the type that when I come into my office or my offices, I would be like, hey, do that. No. You got it all wrong. Okay, when I get in Elite Intellect office, I sweep the floor. Okay, I clean the toilet after the classes. Ini-scrub ko ang toilet kasi guys, one of my stimulations in life, I'm sorry if you don't agree with me, one of my stimulations in life is having dirty toilet. No? Ayoko ng dirty toilet. Kahit gaano kaliit ang bahay mo, kung malinis ang toilet, kung malinis ang lahat, we're fine. 'Di ba? Okay na tayo diyan. Kaya ako pag nasa office, ako talaga nag-i-scrub. Kung minsan guys, pag sinusumpong pa ako, ini-scrub ko yan ng toothbrush. Totoo, talong niyo si Ma'am Zea. Ay, si Sir Jello. Okay. Now, Part B. Part B, guys, are the professional materials. Okay, these are 6 passages with 6 items. Okay, these are professional memos, articles, etc. Okay, and of course, these are multiple choice questions with 3 choices. Okay, so for the part C, guys, these are what we call the long reading tasks. Okay, when you say long reading tasks, guys, these are 2 long passages with 16 items. Okay, multiple choice questions with 4 choices for the part C, and of course, 8 items per passage. Now, items are medical studies, medical articles, yung mga ganyan. And you will have 45 minutes to finish your reading part B and C. Sir, anong mas madali? Part A, part B, and C. Part B and C mas madali. Kasi, sir, anong nagpahirap sa part A? Because of the time pressure. No? Because of the time pressure, it makes it difficult a little bit. Same here, with flowers pa, ang CR. Toilet is the new window to your soul. Yes. Yes. Who can relate? Who can relate here? Okay, let's be honest. We're already titos and titas, okay? Titos and titas of the younger generation. Who here, when you go to your friend's house, the first thing that you check is the toilet, not the fridge? Who? Who can relate? Me. I do that too. Yeah, but instead of telling them what I do, because I'm comfortable with all my friends, instead of telling them that, hey, your toilet is dirty, what I do, I clean it for them. Totoo. Yung mo, nakatulog ka sa condo ng kaibigan mo, di ba, mag-overnight ka, parang, shucks, your toilet is really dirty. So you will be the one who will be scrubbing it. Yeah, I have automatic slap. Huh? So what's automatic slap? Kusang palo. That's the English of kusang palo, guys, no? Automatic slap. Sabi ni Mimi, can you come to my house too, sir? Okay, go. I would love to, my love. Okay. So, what about the speaking of the occupational English test? Okay, so for the speaking of the occupational English test, guys, this is divided into 2 parts, okay? You have the part A, and you also have the part B, which is the role play. Okay, so part A is the interview, just a basic interview. This part is not yet graded, but you would need to answer 3 to 4 professional-related questions. When we say professional-related questions, these are the things that you have experienced. There you go. These are your experiences. Okay, there we go. Okay, hold on, guys. Let me audio. Okay, guys. Hello, audio. Here we go. Okay, hold on, guys. I'm checking my audio. Audio. Okay, guys. All right. So, the part B, guys, is the role play. Here, I love the role play. You can actually play the role of Sisa and no one would care. Charing, no? Okay, so on the role play, you will be given 3 minutes to prepare. Okay, on the IELTS, you will be given 1 minute to prepare for your part 2. Here, in each role play, you will be given 3 minutes to prepare. You look at your role play card and then you prepare your notes, you prepare the things that you would want to tell the interlocutor. Okay, and if you have questions about the case, you may ask on the 3 minutes time. Okay, some students, let's say you have not been a nurse in that field for how long, right? And then you have a question. Okay, so what you could do here is you can ask them a question. Okay, you can ask them a question here. Okay, and each role play is conducted for a minimum of 5 minutes. Okay, a candidate might be given 3 to 4 role play. Sir, ang dami namang role play niyan. 5 minutes lang naman, anak. 5 minutes is a blink of an eye on the OET examination, believe me. Okay, so let's take a look at the sample questions of the OET. Hold on, guys, a little bit ticklish. Mom Zaya, I just need to go to do a quick bladder break. Okay, what are the things that you can say about the OET?
Hi, sir. Hi, everyone. Okay, let me turn on my video. Now, I do think that the upper hand or the merit of actually taking the OET, especially for nurses here, is that it applies to the real life setting. Now, you will have their patients who are non-compliant. Have their patients who are anxious because they do not have any idea of their current situation. Now, I what I do love about this is that you can use your nurse's instinct right here. So I'm a nurse too. Now, the primary reason why our patients are very anxious is that they do not have first-hand idea of what their condition is. Now, the pitfall right there is that most of our nurses, especially in that situation, would explain things using medical jargon, which is a big no-no in the exam. Now, just in case you slipped and you actually spoke a medical jargon, for example, IV and a lot. So you can explain it in a way that your patient can understand. So it's basically health teaching all over. So there is no chance right there that you would not know the topic at all. And it pays to be actually compassionate. You have to use your theracom there, which is something that we have known for the longest time, ever since we are in the first year of our nursing career. And also, one thing that I have learned so far when dealing with patients that are very combative is that you need to try to reflect things on them. You have to clarify and not really bombard, but give them factual and matter of fact answers all the time because it works. In the real life setting, you just need to make the patients understand about the things that they do not comprehend in order for them to actually adhere to the medical regimen that is prescribed to or by their doctors. So I think Mother D is now ready. Let me give back the floor to Mother Dragon.
Thank you so much, Zaya. Sorry about that, guys. Quick bladder break. I'm surprised I have bladder. Okay, guys, so let's take a look at these sample part A questions on the OET. Come on, tell me you don't have an idea about this one. I will slap you. Charing. Okay, let's take a look. What made you decide to take up nursing, right? My parents made me decide to take up nursing in as much as they told me that it's an easy profession to go to another country. But then again, we were boodled. Ay, boodled. Or you can actually say that you are a person who is fond of taking care of the sick. There you go. You see nursing as an art. Mga ganyan, di ba? Nursing for you is something that is quite noble. There you go, right? Or you can totally be honest. You can tell them that nursing is not, what do you call this? I was mesmerized by the white cap on the head. Yes, I was mesmerized by the white cap on the head and the clean uniform, right? You can actually say creative answers here, right? When you were asked, oh, well, for long, nursing has not been my first choice. Really, I would have loved to become a journalist. However, my parents told me that it is a profession that is quite noble, so I ended up enrolling for this course. And what happened was during my process of studying in the field of nursing, that's the time that I have loved the profession itself because we become vital part of the care of the clients. Tapos yung ngiti mo, hindi maipinta. Okay, what else? What are the challenges nurses face? Oh my gosh, you can talk the entire day here on this question, right? A lot of challenges. There are a lot of resource scarcity, overwork, underpaid. There you go, understaffing. Your choo-choo friend, there you go. That JO nurse that just cannot accept that you're already a regular, right? And of course, your supervisor who knows what to say is to do this. Okay, there you go. These are the challenges that nurses face. Okay. During Students' Day, NCP. Yes, NCP is my challenge, right? Salary. I want to change the world. Char. Yun daw yung reason. Okay, what else, guys? How are the working hours of nurses in your country? We don't get out of the hospital. What are you talking about? Are there working hours here in the Philippines? We stay here. We live here. Especially during the pandemic, the duty of the nurses have been changed, right? They stay inside the hospital. I have a lot of OET, NCLEX, and NMC CBT students. But during the review, they are inside the hospital, okay, because they're not allowed to go out. Okay, what else? What are the changes in the field of nursing in your country? I love this question because you can show the versatility and the development or the progression of the field itself. Nurses are no longer limited to becoming room nurses, right? In the past, nurses are known to be conducting care in on the bedside, okay, or in the rooms of the patients. But now nurses have the liberty to choose if they're going to be specializing under one field of nursing. Some nurses do take psychiatry, okay, or psychiatric nursing field, dialysis, there you go, aesthetics. Okay, what else? Nurse anesthetists. There you go. No. So the development here is that the nurses do not, okay, do not conform to becoming bedside professionals anymore. All right, is now accepted in the USA, sir? Just asking for yes, Jing. Okay, there are states that accepts occupational English test. All right, I hate ER when I saw blood from saksak. Yes, Cynthia Villar, di ba mga room nurses daw. Okay, what else? What is your advice for those studying nursing? I think the most viable advice for this one is for them not to see the field of nursing or the study of nursing as their meal ticket. Okay, because once they graduate nursing, they're not yet going to amass their laurels in that point because they would need to volunteer, they would need to review first, pass the board exams or the local board exams, and they would need to volunteer for a minimum of 6 months, right? And there are no regular items that people can actually hand it down to them if they already have a stable job in the Philippines. And if they want to achieve their laurels, they need to go to other countries like you guys, like in the UAE, Kingdom of Saudi Arabia, and then after that, what have you, go to the United States of America, United Kingdom. Okay, some nurses, I'm surprised, even converted to becoming teachers, right? And firemen, right? There you go. Okay, I advise my daughter to have a very long patience and perseverance. Correct. You need to have patience. Patience, not patience. Huh? You need to have patience with the field of nursing. Okay, what else? Sir Joseph, question. Did you love nursing? I did when I was learning, and especially when I was already at Marivelis Mental Hospital as a patient. Charing. Especially shout out to those of you at Marivelis Mental Hospital, Ma'am Cheat, Ma'am Cheat, hello Ma'am Terry, Ate Loben, hello, nasa TV na ako, charing. Okay, so what else? Who is a nurse that inspired you? Okay, there you go. So of course you will think, don't say Florence Nightingale, please. I will stab you if you say Florence Nightingale on the exam. I cannot count how many students said, who is a nurse that inspired you? Florence Nightingale. All right, so you can say your supervisor, a friend of yours, your parents are nurses, your sister is a nurse, your brother is a nurse, your mother, brother, father. How do you brush your teeth? Yung mga ganyan, no? Okay. Dorotea Orem, yung mga ganyan, di ba? Okay. I did, but not psychiatric nursing. Parang I'm one of them. Ako nung nasa Mariveles talaga ako, guys, I feel at home. Okay. What else? If you are not a nurse today, what would you be? Right? If you are not a nurse today, what would you be? If you're going to be asking me if I'm a nurse, if I'm not a nurse today, or if I'm not the founder of Elite Intellect 9, I would either be a doctor or a beauty queen, charing, or a lawyer. Yeah, those are my two. Those are my two dream professions before, is to become a doctor. But then when I experienced med school, I resigned. Okay, so what else? How do you solve conflicts with fellow nurses? Oh, I slap them. I'm kidding. I give them coffee. No, we talk about it, right? We talk about it professionally. The good news about us Filipino nurses is that we can communicate well, right? With the other nurses. Okay, so here is a sample role play card. Okay, I'll give you a sample role play card. Look at this one. You are a nurse in a hospital ward taking care of Mrs. Green, who just finished chemotherapy. Okay, so your task as a nurse is to explore Mrs. Green's feelings, Offer yourself with her care. Tell her the side effects of chemo. What are the ways to alleviate the side effects? There you go. So hello, Mrs. Green. My name is Joseph. I'm one of the nurses here at this hospital, and I'm in charge of your care today. But before that, could you please tell me your first name? Oh, my name's Dorothea. Hello, Dorothea. It's so nice to meet you. Well, I have noticed that you're a little bit not on the well side right now. Do you want to talk about it? I'm not going to do anything. And then Mrs. Green will say, "Oh yes, I don't know. I think I'm just a little bit scared about chemo because they do chemo, blah blah blah." It's totally understandable because if I was in your shoes, I would be feeling the same way. However, rest assured that we are here to take care of you. You have to remember, you might have cancer, but you can find the word "can" in cancer because it can be beaten. Now, I am here for you. The entire medical staff is here for you to take care of you. Whatever it is that you would need, we will be here. Now, let's talk about the side effects of chemo. Of course, it depends on the type of drug that they have used during your treatment, but what are the common side effects are nausea, vomiting, alopecia, which is losing of hair, which is quite normal, okay? You will be totally beautiful and fine even if you lose your hair. You don't have to worry about that. After all, beauty on the inside is not matched by beauty on the outside. Well, for us to alleviate nausea and vomiting, of course, I recommend ice chips. Ice chips could really be removed the feeling of being nauseous and of course can stop vomiting as it is. Mm. 'Di ba? So kailangan medyo compassionate ka diyan. 'Di ba? Communication with comprehension. Correct. Right. Okay. So what else? You are a nurse in a ward talking to Emily, the mother of Josh. Ooh, I thought it was Chris. Okay, you're a nurse in a ward talking to Emily, the mother of Josh, a pediatric client with viral meningitis. Okay, so offer yourself to Emily. Ask about how did Josh feel before going to the hospital. So basically, you're going to be asking information about the SNS or the signs and symptoms of Josh. Okay, when Emily asks, tell her the importance of not letting visitors come after Josh's discharge. 2 weeks. Okay, 2 weeks upon discharge, she's not allowed to accept visitors yet because Josh is immunocompromised at this point. Okay, what else? Tell her ways to help Josh heal with the condition. Okay, so what are the things, diba? We should be avoiding visitors, no fresh food for Josh because he's immunocompromised, no? Walang mga salad, ganyan. Ano pa? No? Try to wear protective equipment when you go inside the room of Josh because it's pretty fragile at this point. There you go. Okay, as you can see, the role play part of the OET is fun in a way that you have already been exposed to these situations before. Some of you already had these experiences, and you get to assume the role of a caring and compassionate nurse. Therapeutic communication skills, okay, is the key. All right. And of course, you should give information and gather information too. What I always tell my OET nurses or my nurses are for them to gather information well and for them to give information pretty well too. Okay, so moving on. The OET writing is the simplest writing exam there is. The task is to write a letter, okay? Before you write, you're going to have 5 minutes to read the case notes, the paper containing the information about your patient, and then you would need to eliminate and simplify the case notes. Not all should be included. And then after that, you'll be given 40 minutes to write. How many words should I write, Sir Joseph? You're only expected to write 180 to 220 words. No? 180 to 200 words is the requirement of the occupational English test. But I always tell my students to try to reach 220. Okay? For the writing, hello. On the IELTS, 150 and 250. That's the minimum. For the OET, 180 to 220. It's a letter. Okay? All right. So let's take a look at this sample letter that I have written for the OET. Okay? Dr. Abigail Cohen, duty registrar. Oh, the patient is Jones. Sorry, I thought it was Cohen. Okay, Dr. Abigail Cohen, duty registrar, 113 Good Hospital, New South Wales. Okay, September 3, 2021. Regarding Martha Jones, 43 years old, a married woman. Okay. All right. Dear Dr. Cohen, this letter intends to give further information about the above-mentioned patient who first complained of pain on our lower right on the lower right abdomen. She was pre-diagnosed to may have suffered with appendicitis and was observed here since yesterday. She would require immediate specialization and management. Okay, moving on. Looking at her social background, Mrs. Cohen worked as a nurse in the Grand Shaw Hospital for 12 years. It is noteworthy to mention that she usually is moving and might not be eating properly due to her responsibilities. With this, she mentioned her family has a history of hypertension, which may be important if ever you decide to perform a surgery. Upon arrival at the hospital, she was observed accordingly by our duty registrar and assessment and laboratory tests like ultrasound and CT scan revealed an inflamed appendix. She also has a fever of 39.2 degrees Celsius since this morning. With this, the doctor has concluded that she would require immediate intervention. To consider all, Mrs. Cohen shall continue the nothing per orem status and her anti-inflammatory medications. For her fever, paracetamol 500 milligrams every 4 hours will be given. It would be appreciated if you could perform the surgery as it was categorized as elective. I have attached all necessary details along with this letter. Should you require further information, please contact me. Yours sincerely, Madame Inuts, charge nurse. Look at that, right? It's that easy to write the letter on the occupational English test. The only thing that you have to know is to place them properly, right? Kala mo kung sino yung nagsulat, si Madam Inus pala, charge nurse pa. Diba? Oh, okay. So look at that. All right, now, for the most important question, can I use the OET examination for my USA application? Let's move on to this one. But before that, guys, congratulations to the new scholars of Elite Intellect from IFNG. If you guys did not know, we have had a scholarship program for IFNG members, and we have selected 3 as the scholars of Elite Intellect for IFNG. So they have won a free IELTS full review from Elite Intellect. So these are the people who have won the free IELTS review. Alorin Campos Cruz, congratulations. Marjeline Kagiwa Francisco, congratulations, Marjeline. Fatima Belahonda Montalvo, congratulations, guys. Congratulations to our new scholars from IFNG. So we are excited to be with you on the review at Elite Intellect. Okay, so congrats, guys. All righty. You're always welcome, guys. Oh, Jiva. All right. So what else, guys? Before we move on, let me just promote this one, okay? So if you're going to look at this one, tired of review full of uncertainties? Is there no quality or guarantee? Okay, now you can be sure that the review has quality over quantity. We will be accepting 10 students for this batch for the IELTS review with the program Elite Sherpa. So lifetime validity, unlimited review, free handouts and preparation books, unlimited one-on-one coaching and speaking and writing, flexible and convenient schedules for both domestic and international students, live and recorded discussions, which you can access anytime. 24/7 coach and mentor support, computer and mobile delivered mock tests, video call, and mock speaking and writing assessments. Now you don't have to choose. Okay, you don't have to choose between the OET and the IELTS, because if you avail of the Elite Sherpas program, you will get an automatic free occupational English test full course review. Okay, so our OET is offered for 8,000 pesos with the Elite Sherpas program. You're only going to be paying 4,999 for the IELTS and the OET. So this is our bonus to all our nurses, because we really admire our nurses that are working hard for the patient. So this is IELTS plus OET. Okay, instead of paying 6,500 for the IELTS plus 8,000 for the OET, you can get them both for just 4,999. So you can send a message to our Facebook page right there. Okay, you can see that on the chat box of Elite Intellect. Okay, for our IELTS and OET program. And of course, in the chat box of the Zoom right here, guys, you can inquire. Okay, what you can inquire to Ma'am Tanya and use the keyword IELTS plus OET. There you go. IELTS plus OET. Okay, so that's only for 4,999 for 2 courses. IELTS plus OET. Okay, guys, sorry, 10 students lang po, ha. Kapag ka po naka-promo na ganito, we're only going to be accepting 10 students. Okay, and of course, guys, buy 1 course, take 2 courses. Okay, so NCLEX plus IELTS plus OET. Yes. Okay, you can get 3 courses for the price of 1. Okay, so this is our NCLEX plus IELTS review course, full course, plus our OET full course. So tatlong course yan, guys. NCLEX, IELTS, OET. Okay, prepare early for your NCLEX, get free IELTS full review course, and an OET review course. Okay, NCLEX plus IELTS plus OET promo is only 7,999 instead of 25,000. Ayaw pa? So send a message to Ma'am Tanya right now for you to choose between IELTS plus OET or NCLEX IELTS plus OET. This is for us to say thank you to the wonderful nurses who have been working hard taking care of the patients during the pandemic. Okay, so guys, I'll see you in class very, very soon. Okay, you're welcome. You're welcome, Kath. Okay, wag puro free live or free lecture. Need din namin ng enrollees, mga jung-jung, Madam Inuts. Si Sir Jeff talaga. Okay, guys, so you may send a message to Ma'am Tanya at our Facebook page right now for IELTS plus OET or IELTS, NCLEX, and OET all in one. Okay, so see you guys in our class very, very soon. Moving on. For the million-dollar question for tonight, okay, can I use the OET examination for my USA application? Okay, for those of you who did stick to the end of the program regarding this one, the answer is yes, you may. OET is now accepted in the United States of America as an English exam prerequisite to replace the IELTS examination. Okay, although, okay, later on I'll show you. In 2020, they have announced that OET will be accepted in the states of Oregon and Florida. Okay, so if you're a person who's going to Oregon and Florida, you can take the OET. And the OET has pre-announced that for the following months, it will be accepted more in other states. There was a published article about this one on the occupational English test that for the following months, okay, if you're not yet going to the United States naman or not yet applying for the following months, okay, then they are going to be increasing the reach of the occupational English test, not just Oregon and Florida. A little birdie told me that I think it will be accepted in California, New York, Texas, pero hindi pa sure sa Texas kasi ang Texas medyo mahigpit, guys. Okay? Pero a little birdie told me that it will be accepted very, very soon on most of the states in the United States of America. Okay, so scores you will need for Oregon. Okay, a minimum of 4 grade Bs. Okay, 350 minimum. So listening B, reading B, writing B, speaking B. Mas madaling kunin to kaya sa IELTS, maniwala kayo. And of course, guys, for Florida, scores you will need for Florida is a minimum of 4 C+. Pag ito, hindi mo pa naipasa, ewan ko na lang sa'yo. Okay? That's C plus 300, the minimum per subtest. Okay? So that's equivalent to a 6.0 per subtest. Okay, so listening C plus, writing C plus, reading C plus, and speaking is C plus. Okay, so C plus, that's equivalent to a 6.0 to a 6.5 on the IELTS exam. Now that right there is an advantage. Okay? Yeah, I think Virginia, meron eh. Oh, yes, guys, no? Yes, Junith, we also have for the medical professionals for the field of medtech, no? Okay, so yeah, look at that, no? That's an advantage, no? So if you're a person who's not yet deciding to go to a specific state, okay, apply. Kung gusto mo na umalis ngayong taon, mag-apply ngayong taon, you can go to Oregon or Florida. But they have posted this article that there will be more states coming soon for the following months that will be accepting the OET. What's the reason? To alleviate the work pressure for the nurses in the United States of America. Ay, di ba? To alleviate the workload of the nurses of the United States of America. Siyempre, kailangan nangunguna tayo mga Pilipino dyan. Di ba? Kailangan tayong nauuna para alam natin kung anong iti-take natin. Okay? So guys, yes. Most importantly, then Isaac sowed in the land and reaped in the same year 100-fold, and the Lord blessed him. This is Genesis 26, verse 12. If you want success in your life, look what Isaac did here. He sowed. He worked for it. Okay? If you are a student who would want to pass the IELTS exam, the OET exam, the NCLEX exam, NMC-CBT, whatever that is that you're going to be taking, you would need to work for it. Okay, nothing is ever handed for you. Okay, even the people with great lives, nothing was ever handed to them in a silver platter. Okay, so you would need to work. But you have to remember that in every work that you do, the Lord should always be with you. Okay, so let's pray for everyone here for tonight. Okay, Heavenly Father, we'd like to thank you, Lord God, for another opportunity for us to teach the students of IFNG, not just on the IELTS, but also for the OET. Father, Lord, hear their hearts, Lord God. A lot of people right now are afraid because of the uncertainties, but we know that you will become the bravery inside our hearts. Father, bless the students, bless their families, keep them healthy and protected. Bless the admins of IFNG, Lord, for the wonderful things that they are doing for the students who are preparing. And Lord, we are also praying for the students who are about to become a part of the elite family. May they have a wonderful experience at Elite Intellect Night. This is what we declare in Jesus' name. Amen. Okay, guys. So yeah, that right there is actually one thing, no? Napakalaki ng advantage ng occupational English test kasi guys, mas mababa yung kailangan yung scores, no? So yes, no? Again, guys, if you want to get the OET plus IELTS promo of Elite Intellect 9, sorry guys, 10 students lang po. No, 10 students lang ang tatanggapin namin dito, okay? So send a message to our Facebook page right now for you to save a slot from Mom Tanya out of the 10, okay? So guys, that is the end of our lecture for tonight for the Occupational English Test Introduction. On Friday, if you are interested with the occupational English test, you're welcome, everyone. You're welcome. You're welcome. If you're interested on the occupational English test, I will be conducting the writing and the speaking lecture. That would be next Friday. All right, guys. So, any questions so far, guys? If you have any questions, please feel free to type it. You're welcome, everyone. You're welcome. Always happy to be here live at IFNG. All righty. Okay, so before I return the floor to Sir Jeff, in behalf of Sir Jello, Mom Tanya, and Mom Zaya, this is your Mama Dragon sending my love to you from the Philippines. I'll see you next Friday, guys. Bye, guys. Thank you guys so much. Thank you, Sir Jeff.
Yes, where are we right now? I think we need to go back to our screen. Thank you so much, Mama D. So paiba ko ng background because I'm not in my house now. But anyway, thank you so much guys, especially to Elite Squad, Sir Clint, Zaya, and Sir Jello. Yeah, Jello, right?
Yes, Sir Jeff, you're
Jello.
welcome.
And to all our members. So guys, keep on practicing, especially for those who are about to take their exam. And thank you so much, sir, for free lectures and prayers.
Bye,
Okay, see you
guys.
again next week. Bye.